Welcome, welcome, welcome. Thank you for joining in. Please confirm if you can hear me. Am I audible? Thank you for the like. Let me know if you can hear me. A lot of things go into content creation, communication on social media. Welcome, welcome, welcome. We are live. Let me know if you can hear me. Let me know if you can hear me. Let me know if you can hear me and if you can see. I hope I'm audible. I want to welcome everyone joining in from different parts of the world. Welcome to this live, a very important session. So get ready. Promises to be highly informative, educational, and then your questions, contributions will be well appreciated. Thank you for joining in. Let me know where you're watching from. Welcome to the live. It's time to act. Time is life. Time is money. So what is time to you? What is time to you? That's one very special gift that we all have. I talk about the gift of life that we have been given by God, and we should learn to appreciate this gift. And we should learn to maximize the gift. That is the gift of life. So I thank God for you that you are able to join in today. From wherever you are joining in, let me know in the chat. Thank you for this quick one, the fast click on the like button. Thank you for double tapping on your screen. Let me know who is here. Who is here? Let me know if you can hear me in the chat. I hope I can get messages in the chat. Sometimes there's usually a gap, a bit of delay in delivery. So I'll just wait for a few more minutes. Let's see those who are able to join in so that we can get into this very important discussion. So Lawale Kolade live, joining in live from where now? Kindly remind me. I know you're not in Nigeria, are you? Okay, where are you? Mr. K from don't worry, I'm going to master your location. Yes. It's an interesting one. Sometimes, interestingly, doctors face a lot, and especially being a doctor in Nigeria, you find out that we have like a doctor to thousands of patients, even at this season. So some patients expect that you apart from my private patients, people that I'm used to, individuals, families that I manage, but in the public space, do you know that sometimes because you have interacted well with some patients, by the time they are coming back, they just expect that you automatically remember that face. Of course, sometimes you remember, but sometimes talking about remembering, putting in mind diagnosis that was made. Thank God for records. Thank God for, of course, many times one can remember, oh, this was the line of discussion with this person. All right. But many times we do not, as a doctor, we do not carry information everywhere. Information talking about medical history of patients. Okay, so sometimes it may apply on this platform. Pardon me if I may have to ask for your location many times. Okay, and interestingly, maybe you traveled from France to another city. Okay, Mr. Lawali Kolade, live from France. Thank you for your consistency. Thank you for always tuning in. I just wish YouTube could actually help us to start seeing faces on the live, and you can just see who is live, who we can accept to join the live, and things like that, without going through the third party or going live together that's available on the platform. So I'm looking forward to that. Mr. Kolade, yes, it's a lot, I understand. Thank you for your understanding. So, Mr. K from France. You m'appelle what now? So, how are you today? What time is it in France? What time is it in France? This promises to be another interesting session. I will want to request that you share the link to this live with one or two persons, with your group, with family members, with friends, with colleagues, because I know there are many people in different parts of the world who have questions relating to this topic. Yesterday was World Stroke Day, and we won't let it just go like that. Okay, so we need to talk about stroke. So it's 8:51 p.m. in France, so just about the same time. All right, so that's interesting. Same as Nigeria. Okay, thank you, Mr. Kolade, for the feedback. So, how was your day? By the way, what do you do, Mr. Kolade? What do you do? I hope you are enjoying France, and I know it's a public space. Sometimes we want to have some privacy. Okay. So, but I really appreciate if you can let us know what do you do. I'm not sure if you're a content creator, but maybe some other career or profession. All right. So thank you for always staying tuned, connecting, and engaging. All right. So we are welcoming people to the live. Materials scientist and engineer. That's interesting. Mr. Olawale Kolade is a materials scientist and engineer. It's good to have you here. All right, so we have many professional individuals who are members of the community, and we celebrate each and every one. Thank you for your time. It takes commitment, it takes interest, it takes passion, and I mean the commitment that you have to your own health to getting professional information, to connecting with a community of health enthusiasts. So it's interesting to know that you are one of us. So healthy people who are live, joining this live, let's know where you are watching from in the chat. Kindly introduce yourself so that we can celebrate you. Yeah. So what do you know about stroke? Okay, I'm putting up a question. Yes, right there. Where are you joining from? I don't want to say watching. I don't want people to just watch. We want people to engage, and that's one interesting thing. One very important aspect that people should consider. Okay, hello Neil. Neil, how are you? Welcome to the live. I hope you can hear me. Neil says, hello doc. Thank you, Neil. Kindly double tap on your screen to like the live, and please share this with people in your community. I'm sure they'll find this session very interesting, and it's an important one at that. Hello, Neil. Neil is saying hello. How are you today? Please, where are you watching from? Where are you joining us from? Let me know in the chat. If you are Joyce joining in, welcome to the live. Kindly introduce yourself. We need to act fast so that we can get deep into the discussion and see how much we can get to do tonight from this side. What time is it in your location? Neil, what time is it in your location? So, what do you know about stroke? What do you know about stroke? All right, in some regions, some people believe that it's actually an attack, possibly from some people that are not happy with an individual, so they attack the individual with a stroke. Okay, there may be some spiritual dimensions to some health issues, definitely, but many times, many medical conditions, including stroke, have their origin outside some kind of attack from the enemy also. Talking about people, individuals that people think that they do not like them. Oh, from the land of the Himalayas. Wow. Good to have you here. Thank you for joining in. The land. How about the mountains there? Welcome. Thank you so much. So we are talking about stroke and the need to act fast. Interestingly, looking at the world celebration of World Stroke Day yesterday, being 29th October 2025. And the theme for this year's World Stroke Day is every minute counts. Yes, every minute counts. And that simply means that not just talking about time being money, time being life, but the neurologists, the World Health Organization, have come up to say that time is actually brain, time is neuron, and we need to act fast to save the brain. All right. Many people who develop a stroke, anyone who develops a stroke, probably many times they never planned it. Really, never planned it. Of course, usually happens like a sudden event, a sudden experience, and it's a condition that affects the brain. And then that's why the neurologists say time is brain, time is neuron. Talking about the nervous system, the connection, the cells involved in the workability of the brain. And then looking at the fact that the brain serves as control over all the parts of the body. That's very interesting. So it's a control center. It's like one headquarter. The heart also serves in a similar manner. So if you're talking about death, we talk about something called brain death. A person could be said to have died, but if there's still some form of activity ongoing in the brain, you're not be able to certify really that the person is dead. So there's something called brain death. So when this happens, there's really nothing anyone can do. So what is a stroke? A stroke is a medical condition. It's actually an emergency condition, usually sudden events that cuts off blood supply to the brain, it cuts off oxygen supply to the brain, and these are things that the brain needs to perform its function. So looking at my communication with you, I'm talking, blinking my eyes, making movements with my hands. The brain has a major role to play in our activities in life. So there are different parts of the brain that control different parts of the body. Okay, movements, speech, sensations, the eyes, smell, different parts of the brain represent different functions in the body. Okay, so if anything happens to the brain, where there is cut off of blood supply, there is cut off of oxygen, the brain is being deprived, then if it's a particular part of the brain, then that part of the brain will not be able to perform its function. That's just it. So it's something similar that happens with vehicles. When you talk about blood, it's about fuel supply. Talking about petrol or diesel, depending on what the vehicle uses. For any reason, if there's a shortage or a blockage in the flow of petrol or fuel to different parts of the engine, then there may be an issue. There may not be effectiveness. The vehicle will slow down. The vehicle may even stop working. All right, so that's the way I will explain how the brain needs blood and oxygen. The blood contains some nutrients, and then the oxygen that helps in its vitality. I hope you are getting me. Let me know if you can hear me in the chat. So that's one simple explanation for a stroke. And there are different types of stroke. One is that which occurs when there is a bleed or bleeding into the brain. So the blood supply, the vessels carrying blood may burst like a pipe or a hose, thereby leaking out its content. So blood can flow in the brain, in fact, can keep flowing, accumulating, and then because the brain is contained in a cage, in this called the enclosed space, there is no room for expansion, there is compression, and that affects the function of the brain. So depending on the parts of the brain that is affected, if it is the speech area, if it is the movement area, whichever part, that individual will experience loss or some level of difficulty in the use of that particular part. I hope you're getting me. And then there is the one I just explained is the hemorrhagic stroke. While the second type is the ischemic stroke, where there is usually a blockage in the flow of blood. This could be from plaques formation, could be from blood clots, it could be from deposition on the walls of the vessels. So depending on the part that's affected, there will be a manifestation in that particular part. And I need to let you know that it is very important to act fast. I'm going to mention some of the symptoms that may mean that an individual is suffering from a stroke or has just suffered a stroke. Okay, but there is the third type. I've just talked about the hemorrhagic stroke, talked about the ischemic stroke, and then we have there is the transient ischemic attack. Let me know if you can hear me in the chat. Let me know if you can hear me in the chat. I hope you can hear me. Please let me know in the chat if you can hear me. Please confirm that you can hear me. Am I audible? Mr. Olawale Kolade. Do you mean you can hear me? Okay, sound is okay. Thank you so much. Thank you. So let me put on my video. All right, thank you for the feedback. Yes, so let me know if you got the confirmation of the different types that I mentioned. Can you type in the chat? Kindly type the types of stroke mentioned. That is your test now. So let me know those who have been following. Okay, what are the types that I mentioned in the introduction? The types of stroke. Time starts now. Let me see the first person to type and post in the chat the types of stroke mentioned. Waiting, waiting, waiting. Oh, okay. Oh, sorry about that. Mr. K says I was away from my phone for some minutes. Okay, so I'm going to quickly go over that. Yes, I'll recap. Thank you for your feedback. So I hope you got the explanation that I did on what a stroke is. It's usually a sudden event that occurs in the brain, and there are challenges. The challenges with blood supply and oxygen supply to the brain. So that's what a stroke is. And I mentioned that there are different types. I started by saying there is that type where there's a bleeding into the brain. Okay, someday I should have a board where I will actually begin to demonstrate things like this, okay, to illustrate, and that will really be helpful. Okay, but if you look at the brain also has blood supply like some other organs in the body. You know, talking about the arteries that go there, and then the veins to also pass through the different parts of the brain. So if for any reason there is a burst in the pipe, okay, that's the artery supplying different any part of the brain, there's a leakage of blood, then that can be described as a stroke. Okay, and the second type is that where there is a blockage. You know, the first one we talked about the flow, leakage of blood. The second type has to do with blockage such that there won't be a flow, little or no flow of blood. Here, this is the vessel, or something blocking it here. All right, so with that, there's going to be shortage, or the blood supply will be cut off, oxygen supply is cut off, and then the brain may die at that point also. Okay, so depending on the part of the brain affected, there will be different manifestations. So that's why individuals may not necessarily have the same symptom when there's a stroke. But I'm sure you've heard before when people say they had a partial stroke. Okay, so what that is simply saying is that for some people they mean a brief experience of a stroke, or some others they mean, oh, this was affecting a particular part of the body, one side of the body. So usually if there is a side of the body that is paralyzed or weak, then it's usually the fact that is the other side of the brain that is affected. So that's just a simple explanation. Now there's a third type of stroke, and that is the transient ischemic attack. That occurs as a brief, very brief, could be for 2 minutes, 3 minutes, 5 minutes, less than 30 minutes of experience of a stroke. That happens and the individual gains recovery. It could be a slurred speech, it could be a weakness in one side of the body, and the individual is able to regain within 30 minutes of the event. Very transient, it could be less than that, 15 minutes, 10 minutes, and usually some people just overlook this and say, oh, maybe this was an attack, you know, depending on the side you are coming from. Some people begin to go for traditional treatments rather than seeking good professional intervention. Okay, because a transient ischemic attack, that's like a warning sign of stroke, that the individual, if not careful, can have a full manifestation of stroke. And I need to let you know that for every stroke event, if an individual has a stroke today, if there for any reason there is a repeat stroke, the experience is usually worse than the first experience. I've seen patients with repeat stroke, second experience of a stroke, the third experience of a stroke, and then that keeps getting worse in terms of the manifestation. Some people don't even have the opportunity to survive. I hope you got my recap. Okay, I'm already moving to I'll be talking about I'll give you some information on some statistics when it comes to this topic we are talking about. Let me know if you can still hear me. Welcome. If you are just joining us, welcome. We started diving into the discussion, but we want to know where you are watching from. Let's know where you are watching from. This is Health, Wellness, and Lifestyle. Your doctor, your family doctor here, live from Nigeria. Let's know where you're watching from. Mr. Olawale, hope you got the recap. It is said that every 2 minutes, at least 3 people die from a stroke. And then some statistics, some say it's 28, can be like up to 28 people all over the world. But do you know that it is the second leading cause of death globally? And that's, of course, after cardiovascular diseases such as hypertension, heart attack, myocardial infarction. So stroke is the second leading cause of death all over the world. So it's very important that we talk about this. It's actually responsible for 7.3 million deaths all over the world. That is serious. That's shocking. And it all depends on the location. The numbers will differ for different locations depending on access to healthcare services, whether the individual has early access or not, depending on available resources for managing such conditions. And then there is the risk. There are risk factors associated with developing a stroke. So what are those risk factors, which I'm going to be mentioning? So the more the risk, the higher the morbidity, the higher the mortality. So that's talking about the quality of life. It is one condition that is responsible for disabling people. It reduces the quality of life of individuals who are affected by a stroke. Have you ever seen a stroke patient? Have you ever come across one? Or do you even have a relative, a friend, a colleague who has suffered from a stroke? And it depends on the extent and the intervention that was made at that point. There is usually a need for rehabilitation, but some people are not actually able to do as much as they were doing prior to the event or the experience of a stroke. So it's the leading cause of disability worldwide, and we need to talk about this. And one interesting thing is that there are different causes of stroke, and commonly, okay, thank you, sir, it's clear. Okay, Mr. Lawale, thank you for your feedback. So it's clear. So let me know in the chat, what are the types of stroke? What are the types of stroke? It is said that in the United States, about 795,000 people are diagnosed yearly of a stroke, having a stroke. And 610,000 of these cases or individuals are usually new, while about 185,000 are usually old. So that means there are some people that actually develop, they have a repeat stroke. and that is with a poor prognosis, usually worse than the first experience of a stroke. I hope you can hear me clearly. Okay, Mr. Lawale says leakage of blood. Yes, that's one. Blockage of blood. Okay, that's two. Transit attack type. Okay, very good. Okay, so is the leakage of blood, yes, into the brain because there's a leakage, there's an opening from the blood vessel, which is not a normal thing. And then the blockage of that blood vessel, so blockage of blood supply, that's it, to the brain. Then transient ischemic attack, I've described that. So let's look at what are the features, what are the things that you can notice in an individual that you need to watch out for to say, oh, this is a sign or symptom of stroke and there is a need for action. Now, one, we'll be using the BFAST acronym. I don't know if you have heard that before. There's the FAST acronym, there's the BFAST acronym. BFAST, as in BEFAST. BEFAST, be fast. So we look at that, and the first B, the B stands for balance. So there may be some form of abnormal gait for somebody that was never involved in a trauma, any trauma to the legs, no accidents, nothing before. The individual just starting to lose balance, abnormal walking. When you just notice this, this may be a sign of a stroke. Another is what happens to the eyes. Some people may begin to have blurring of vision. Some people may even lose their sight. Sudden loss of vision may also be a sign of a stroke event. Now let's talk about the F. F for face. Sometimes you notice an individual with a drooping of the face, maybe the eyelids, part of the face just flat and all, not just equal. Just notice that abnormality. That is also a sign of possible stroke. And then talking about the arms, inability to lift the arm. The individual just feels heavy. You ask the individual to lift the arm, just feels. Some people wake up with that, unable to lift their arm or even the leg on the same side. That is another possible sign of a stroke. Next is the speech. Usually for an individual who never before had any difficulty with speech, begins to notice slurred speech, not clear, speech is not clear, people cannot understand. For somebody that usually will communicate properly, clearly, that is another. Now, talking about the face, sometimes you see some deviations in the mouth, the angle of the mouth in such individuals. So I'm sure somebody must have heard or seen something similar somewhere. Then the T is time, and time is of essence. For example, if there is a presentation within 30 minutes, within 3 hours of symptom, there may be some interventions that can help to reverse or to stop the progression of symptoms. However, when there is late presentation, little or nothing can be done. Some people may even pass on if the condition worsens, especially in hemorrhagic stroke. I need to mention that ischemic stroke is actually more common than hemorrhagic stroke. All right, let me know if you can still hear me. Let me know if you can hear me. Am I audible? So we've talked about the FAST acronym. Now we'll be looking at the risk. What are the risk factors for stroke? Most people know that, most people should know. I don't know if you know, let me know in the chat, that hypertension is one common cause of stroke. Uncontrolled hypertension, poorly managed hypertension, severe hypertension can lead to a stroke. And many people are hypertensive and they do not know it. Many people are carrying high levels of blood pressure and they do not know it. It's one reason, one cause of sudden death, one cause of stroke. What are the other causes of a stroke? Some that you may not know. Let me mention to you that diabetes mellitus could also cause a stroke. Diabetes, some autoimmune disorders, conditions can also lead to a stroke. Stress can lead to a stroke. Alcohol intake, smoking, this puts individuals at risk of a stroke. Even though stroke is not communicable, but they said that there may be some genetic factor to developing a stroke. People who are overweight, obese, people with dyslipidemia, high levels of cholesterol, they are also at risk of developing a stroke. So there are non-modifiable factors, like I usually say, talking about age factor, the race, family history, but there are modifiable factors, which include the diet. You need to eat balanced diet, eat balanced meals, you need to avoid alcohol, avoid smoking. These are risk factors that are modifiable. Something you can do about that to prevent having a stroke. So I'll be talking about some common questions that people ask when it comes to stroke. So what should you do if you think someone is having a stroke? That's one question that some people are asking. So knowing that time is brain, if nothing is done immediately, the individual may lose function in some parts of the body. So as much as possible, going to the nearest hospital. If you are in an environment where you can call the emergency, definitely you should call for help, call for an ambulance. The individual needs to get to the hospital fast. So depending on your location, you need to find out the emergency services available, and so that you can get the individual to be seen immediately and necessary interventions be taken. So what can be done in terms of lifestyle changes? I've mentioned that quit alcohol, quit smoking, eat balanced diet, engage in a balanced life, social life, engage in exercises, and these are very important things to do. Interestingly, if you know or you are hypertensive, know someone that is diabetic, these conditions need to be managed appropriately for prevention of a stroke. There must be good control. So what happens after a stroke? The question is, can the individual gain full recovery? That's a very important question. So what are the long-term effects? Will the individual be able to speak again? And that's one question that relatives, caregivers ask. I want to know, will he or she be able to speak again? Will they be able to move well again? So all these are dependent on different factors. One, the timing of presentation. Early presentation is quite important and will be very helpful in limiting the progression of the event. So that's very important, early presentation. And of course, where there is the right professional to handle, talking about your doctor, the other workers, professionals who need to be part of the team to handle the emergency situation. All right, so that can help a lot. So long-term effects, of course, as I mentioned earlier, it's the leading cause of disability worldwide. It reduces quality of life. Imagine somebody who is a driver and no longer move his hand or his leg. So that puts some limits to what the individual can do, and that can also affect psychological health, mental health of the individual, can also affect financial uh, life of the individual. So recovery can occur, but the extent will depend on different factors: early intervention, and then rehabilitation plans, how well and how committed the individual and the team managing, how committed they are to the rehabilitation. So that's that. Next is, what are the treatment options when there is a stroke? Of course, the individual will need to be seen immediately. A brain scan may be requested to determine interventions that need. If there's a patient that has a blockage, like I mentioned earlier, and the blood supplying that part of the brain, individual can receive medications to dissolve, let me use that, dissolve the clots. And then other interventions include, for hemorrhagic, there may be a need for surgery, a borehole to remove the blood collection or fluid collection in the brain. So what are the long-term effects? Of course, the weakness of the hand or leg. Some people will do well to regain, some others have difficulties regaining. Okay, speech problem. The individual may also suffer from abnormal speech. So other things, of course, include the eyes. If the individual has blurry vision, or even has lost their sight, this may not be able to be regained. So those are some long-term effects of the stroke. So how soon must someone who has a stroke get to the hospital? As soon as possible. Time is brain, so get to the hospital as soon as the event is happening. Okay, so let me answer this question about the common myths. There are some common beliefs, and some of these are false beliefs that people have about stroke. Some people believe that stroke only happens in the old age group, old people. No, we see stroke happening in the young, and there are other causes, like I mentioned. For example, if the individual young person develops hypertension, the individual has diabetes, or even the sickle cell anemia, this puts the individual, no matter the age, at risk of developing a stroke. If the face droops, it's always a stroke? No. Every of those symptoms I've mentioned, that's why it's important to take the individual to the hospital to be seen appropriately, where questions will be asked, proper history will be taken, and then if the individual is confirmed to have a stroke, then necessary management protocols will be applied. So what about my hearing and vision? Does it mean that individual has a stroke if they have a vision problem? Vision problem could be due to anything. It can be due to cataracts, can be due to glaucoma, so that's where history comes in, examination, and then proper diagnosis with relevant investigations. So how does stroke affect young people? Can it happen to people in their 30s, 40s, or 50s? Yes, I've just said that. If people in that age group or age bracket, if they have hypertension, diabetes, they have sickle cell, they have been undergoing stress, this puts them at risk of developing a stroke. Let me know if you have any question, any need for clarification. Kindly drop in the chat. So the emphasis is on time. We should waste no time. If you have symptoms, may even just be some experience of weakness in your limb, maybe the arm or maybe the leg, and you need not waste time. You need to see your doctor as soon as possible for proper evaluation. Are you noticing slurred speech? Are you noticing that in yourself or another? That's another reason to see your doctor. Okay. uh, Blurring of vision, talk about that. So very important to see your doctor. Let me know what you have been able to gain from this uh, important live session, talking about stroke and what you need to know, what you didn't know. you know if you didn't know that sickle cell anemia can cause a stroke, now you know diabetes mellitus can cause a stroke. Some autoimmune disease conditions can cause a stroke. You can drop your question, you can drop your comments. Let me know if you have learned something and what it is. Drop your question, your comments. So it's all about stroke awareness. We need to act fast. Time is neuron, time is brain, time is money, time is life, and we need to act fast. So thank you for joining in. We will definitely be looking at more things relating to this topic nearest future. So thank you everyone who joined in for such an interesting session. I believe you have learned something.